Good afternoon, everybody. We're so happy to have you here this afternoon. We have about 14 participants on. I expect to see more as we move into the hour. I want to thank you again for joining us today. My name is Davelyn Patrick, and I work with Families Helping Families of Southwest Louisiana as the Bureau of Family Health Community Resource Specialist. We're pleased to welcome our special guest, Ms. Maria Alvarez, today. But before passing the presentation to her, I would like to introduce you to my coworker, Ms. Melinda Elliott. She's going to take a few minutes to tell you about LACAN. Go ahead, Ms. Melinda. Thank you.
Hi. So LACAN stands for the Louisiana Council's Advocacy Network. Every region of the state in Louisiana, there's 10 of them, 10 LDH regions, has a LACAN leader. The region in New Orleans, 2 of them, like Region 1 and Region 10, share a leader. But so there's really 9 of us, even though we cover 10 regions. But we have a team of people, parents, people with disabilities, professionals, people who care about people with disabilities, that advocate for systems that support children and adults to live in their own homes, to go to school in their own communities, to work, play, do whatever people do in their own communities. So every year we have a legislative agenda. We are already working on our legislative agenda this year. We're kind of excited that one of our legislative agenda items has already been, the Louisiana Department of Health has already agreed to do it as part of their annual budget, adding incontinence supplies for adults on one of the 3 human home and community-based waivers. Other waivers in the state included incontinence supplies through Medicaid, but for some reason the home and community-based waivers didn't. So that's been great that one of the 4 has already been accomplished. We're pretty much working hard on open meetings laws so that committees and organizations can have virtual meetings for people with disabilities and for parents of people with disabilities that can't travel, to be able to have meaningful participation in meetings. So we're working on that as you speak. There's an action alert as we speak about it. We're going to have a yellow shirt day Friday. People are going to go to the legislature, and we have these signature bright yellow shirts to when we go to the legislature as a group, so that we're recognizable. People spot us right away. But we're also emailing the committee and the chairwoman. And that's one of the things. I'm sure Wallace has already dropped the link in the hot link in the box for you to go to www.lacanadvocates.org and sign up. It's free. And you're going to get these action alerts on different things that we're working on in the state that have to do with our legislative agenda. So that was 2 of them. The third one is funding for Families Helping Families. The past couple of years, we've been able to get more funding for services for our families. And we're back at the table again this year to ask about it. You know, the price of everything has gone up, whether it's electricity or whether it's rent or whatever. So the price of business has gone up. We're also asking the legislators to make it clear that they want that money. It's $500,000 for 9 of the 10 centers to be recurring money, so we don't have to keep coming back and bothering them, and they don't have to keep hearing us talk about, you know, how expensive things have gotten every year. And then the last one is called post-secondary outcomes. A lot of people have realized that when school ends at 22, there's not a whole lot for people to do. Some of the colleges have started a consortium that they call LAPI, and because they have post-secondary programs for people with intellectual disabilities. They're very small programs. So last year we went to the legislature and asked for $1 million, which really isn't a whole lot of money compared to the state budget, to be able to for universities to be able to start programs or to expand programs. Now, once they get certified, they can start getting some funding through FAFSA and through other sources, but to get it started takes a bit. And so we're back this year asking for $3 million in the hopes that we won't have to come back every year. But we can expand these programs. Some of the programs are so small, there's only 4 people. So what are you signing up when you sign up for free? You're signing up to get those alerts, asking you to email people, typically legislators, not always, but typically. You can participate in Yellow Shirt Days, and we can find you one of those bright yellow signature shirts. Sometimes some people have a story, an impactful story, and either tell their story at the round tables that every region has every year, or at the table for testimony at the legislature. Not everybody, and you're going to get lots of coaching if you're in a position to be able to do that. Legislative visits. We personally try and go visit each legislator in our area every year. Parents come with us on those. And you're in the know. That's the most important part. So let me check the chat box and see if I see things. Okay, Wallace is putting things in the chat box. If you have any questions, come back and ask me, and we or ask me now, because I'm always ready to ask questions, or you can contact me at the Helping Family office. And back to you, Davelyn.
Thank you, Ms. Melinda. For the purposes of sound quality, I want to let you know that everyone's muted for today's webinar. I want to let you know as well that when we finish the webinar, you'll be prompted to complete a post-event survey. And lastly, as you probably saw, the webinar is being recorded. Ms. Maria Alvarez is a Social Security Association Public Affairs Specialist. She's been with us before. She's a wonderful resource and is very clear in her presentation, which is helpful to someone like me. She's going to be sharing information and updates with us about Social Security and people with disabilities. She'll be answering your questions at the end of her presentation. So send those by entering them into the chat if you don't mind, and we'll get those to her at the end so that she can answer them for you. With that, I want to welcome Ms. Maria and pass it off to you. Thank you so much for being here with us.
Thank you so much, Davelyn. And thank you to Families Helping Families as a whole for inviting me to share our program information with you today. My role with Social Security is that of a public affairs specialist. And basically what that means is that I provide our program information in the form of education to the public. I do presentations on any of our benefit programs, whether it is disability, meaning SSDI and SSI, or retirement presentations. So I have a very comprehensive presentation prepared for you today. So I'll probably answer many of your questions along the way today, but For the sake of time, I do ask that you hold your questions until the end of the presentation, and we'll definitely make some time to answer those questions. With that being said, let me go ahead and get you to see the presentation. And let me know, Dave Lynn, if you can't see the slide at any point, but I'm going to go ahead and get started with the disability presentation. So Social Security has two programs that provide disability benefits for the public. They are SSDI and SSI. And they both pay monthly benefits. They share the same definition of disability. They are, of course, administered by the Social Security Administration, but they also have some very different non-medical eligibility criteria. For example, if you were approved for SSI, you automatically here in the state of Louisiana are approved for Medicaid. Now, that's not the same in every state, but here in Louisiana, the income and resource eligibility criteria for SSI and Medicaid are a mirror image of each other. So once you're approved for SSI, Medicaid picks up that information off of our computer system, and they go ahead and send the individual that Medicaid card automatically. So we're on an advantage here with that process here in Louisiana. So with the SSDI program, however, you get Medicare, not Medicaid, but Medicare, and that's after 24 months. There are a couple of conditions that if you are approved based upon those conditions, you do immediately get the Medicare. There is no wait. And basically those are ALS, or more commonly called Lou Gehrig's disease, and then also ESRD, or chronic renal failure, meaning that you are dependent on dialysis for your care. Excuse me. SSDI pays certain dependents. If you are approved for benefits and you have minor children, for example, they can receive a benefit check as well. There are some limitations to that, but generally speaking, that's how it works. SSI, however, pays only the disabled person. The definition of disability for adults is the same, whether you're filing for SSDI or for SSI. It's a pretty strict definition of disability. So it's a physical or mental impairment, or of course, it could be a combination of things, physical and or mental, or just a combination of physical conditions that prevent you from doing any type of work. It has to have lasted or is expected to last 12 consecutive months or more, or result in death, meaning that it's a terminal condition. So by that definition, I think you would understand that it's not a short-term disability program. It's pretty much a disability program of last resort, seeing that you have to have a condition that's going to last for a considerable period of time. If you have some type of disability that is supposed to improve prior to a year's time, then you would look to some type of short-term disability program, such as some type of disability insurance you might have through your employer, or some type of workers' compensation, or that type of thing. But certainly for SSA disability, it has to be a severe disability that's going to last at least 12 consecutive months or be terminal. For adults, we look at the inability to do any type of work, meaning any substantial gainful work activity. We call that SGA, substantial gainful activity, work activity. And we apply a dollar figure to what we consider substantial gainful work activity to be. This year, in 2023, gross earnings of $1,470 a month or more are considered substantial gainful activity, meaning that that's the work activity, the earnings activity that a non-disabled person could possibly be working and earning. Now, as you can see, for blind individuals, that amount is a little higher, but these amounts go up slightly every year. Not a whole lot. They tend to stay somewhere in this area. It's not a drastic increase, but definitely it's a dollar amount that we place on that substantial gainful activity. So what that means basically is that if an individual comes into one of our offices and wants to file a claim for disability, if they're an adult, of course, the ability or the inability to do work is primary, but let's say they are still doing some work activity, we're going to ask them what their gross earnings are monthly, and if they are at this SGA level or more, the claim for disability would not move on to the disability determinations phase, which is the phase which actually requests medical records and makes a medical determination for eligibility for benefits. So for both SSDI and SSI, the claim can be denied if the individual is working at this level or more. So let's talk about the definition of disability for children. Let's say it's a child filing for SSI benefits. Well, for the most part, children do not work, of course. So the inability or the ability to work is not an issue. What we do look at is the ability of that child to hit their developmental milestones at the appropriate age levels. So can they learn at a rate that other children their age are learning at? Can they do the age appropriate tasks that other children who do not have a disability are performing at? We also look if it's a premature baby, if they weigh 1,200 grams or less at birth, they can be automatically approved as well. With the preemies, we evaluate their condition after 1 year to determine if they're still meeting our disability criteria. A lot of times premature babies will progress throughout that year and kind of catch up, if you will. If that's the case and they're now thriving, of course, they would no longer be eligible for SSI if they no longer have any other qualifying conditions. If they are performing and meeting those developed milestones at age appropriate levels, they would no longer be considered to meet the disability criteria for Social Security. But in many cases, these premature babies can continue to have some challenges, and if those challenges, those conditions that they're struggling with, if those still exist at that 1 year time period, then of course the evaluation can determine that they are still eligible for SSI, and therefore they stay on the record. A lot of times people ask, how often are people's conditions reviewed to see if they continue or eligible to continue to receive our benefits? Well, The answer is it depends on the disability. So as I mentioned, for premature babies, since generally speaking, after about a year, they might catch up. But depending upon the condition, it might be a year, it might be 2 years, it might be 5 years, it might be more. So if it's a condition that medically speaking, it's not expected to improve to a level to which you would no longer be meeting the disability criteria for Social Security, well, we might not evaluate that condition for a number of years. But when the record is due to be reevaluated to see if the disability continues, the individual receives a letter from Social Security letting them know that we want to schedule an appointment for them to provide the necessary information for us to start that reevaluation. And of course, the benefits continue until that evaluation is completed and a new determination is made as to whether eligibility ceases or continues. So let's talk a little bit about some other non-medical requirements for the SSDI disability program, Social Security Disability. Well, the basic difference between SSDI and SSI is with SSDI, you do have to have worked and paid in to Social Security to be eligible to file for the benefit, even before we look at the medical condition. So you do have to have worked and paid into Social Security. Now, depending upon your age at the time you have or you acquired this condition, that's going to depend upon how long you need to have worked and paid in. So I'll give you an example here. At age 24, a person only has to have worked and paid into Social Security for about 1.5 years. So the younger you are, the less time that we require that individual to have worked and paid in. And this is pretty reasonable because the younger you are, the less time you will have had to work and pay into Social Security, of course. The older you get, for example, here at age 29, then we need to see a few more years of contributions. In this example, it's about 4 years. At the time at which you reach 30, 31 years of age, we generally are looking for about 5 years worked out of the last 10. So if a person who is 30 years old, 31 years old comes in, we're going to look to see if they have contributed or paid into Social Security for 5 out of the last 10 years. Does not have to be consecutive, does not have to be the last 5, but 5 years anytime within the last 10 years. So that would have basically earned them about 20 credits. And that's what we're looking for them to basically be eligible to file for the benefit and for us to see if they then meet the medical criteria. So this is very unlike retirement benefits for Social Security. For retirement benefits, you have to have 40 credits earned. So that's 10 full years of contributions into Social Security. The difference is that they do not have to be recent. For retirement, you could have worked and paid in between age 30 and 40, just an example of an age period, and not have contributed in again between 40 and 62. And at 62, which is the earliest you can claim retirement, you can come in and claim or apply for your retirement benefits. And those years work between 30 and 40 are etched in stone for you, and you're good to go. So like I said, for disability, that's very different. We're going to look to see if you've worked recently or prior recently, within a certain period of time prior to becoming disabled or acquiring that disability. For SSI, you do not have to have worked and paid into Social Security at all. And this is basically why children qualify for SSI, because we're not looking for any time worked and paid in. But for SSI, you do have to meet income, resource, and some other criteria. It is a needs-based program. So we look to see what the person's income is. The income is expected to be very low, or the person to have no income for eligibility for SSI. And remember, I mentioned earlier that the income and resource criteria are identical to Medicaid income and resource criteria here in Louisiana. So if you meet the Medicaid criteria, a lot of times people have a better sense of whether they might or might not meet the Medicaid criteria. But for SSI, it's about the same. For example, I'm going to talk about this a little bit more, but for resources, it's $2,000 is the individual resource limit. So it's you have to have few or no resources to qualify for the SSI. You also have to meet certain residency and citizenship requirements. The residency and citizenship requirements are a lot. You do have to meet residency, but if you are not a resident, but you have some other type of legal status in the United States, meaning if you're a qualified alien, if you have been paroled into the US, if you came in with some type of asylum, you may qualify for SSI. And when I say may, I mean you might qualify. There are a lot of different immigration type criteria that we have to look into. But generally speaking, it's possible that even if you're not a citizen, and even if you don't have your residency yet, you might qualify for SSI. But I can tell you that individuals that are in the United States illegally would not qualify for SSI benefits. Besides SSI, there are other ways that children might become entitled to Social Security benefits. Of course, as I mentioned, SSI is the most common benefit that children qualify for, but children may also qualify for other benefits. Minor children, even if they're not disabled, if they are the child of a recipient of our benefits, meaning whether that's retirement or SSDI, meaning Social Security disability, where a person has worked and paid in, they might be able to receive benefits on that worker's record. And those benefits may continue even after the child turns age 18 or 19 if still in high school. So normally, even children who are not disabled, if they are the dependent minor child of a Social Security retirement or a Social Security disability recipient, they qualify for a benefit check on that worker's record as their dependent, but normally at age 18 or 19, if the child is still in high school, At that point, the benefit ceases because they're now considered an adult, no longer considered a dependent of the worker. But if that child has a condition that they have had since prior to age 22, they are potentially eligible to stay on that parent's record past age 18 or 19 if still in high school. So think about a condition such as, let's say, Down syndrome. That's certainly a condition that a child has had since prior to age 22. So if they have a parent that is retired under Social Security or receiving Social Security disability, that child would be receiving a benefit check. At age 18, normally the dependent would no longer receive, but if that child acquired that condition prior to age 22, they would continue to receive benefits on that parental record. The reason this is a really good thing is because, generally speaking, what that child would continue to receive on the record of the parent is usually higher than what they would receive under SSI on their own. If it's not, it is totally possible for the child to continue to receive in the parents, the benefit on the parent's record, and then they might qualify for a little bit on their own on SSI. So it is possible that a person might receive both. The only way that you can receive both is that between both benefits, it does not exceed the SSI benefit amount. So just to give you an example, if a child is receiving $1,000 on a parent's record, they turn 18, but the child has a disabling condition that they've had since prior to age 22. That condition qualifies under Social Security criteria. That child continues to receive benefits on the parent's record, that $1,000. So because that's over the SSI limit, they would only stick with that benefit on the parent's record. But let's say that benefit is only $500 on the parent's record. It's very possible that that child, even though continuing on the parent's record to get $500, might be eligible if they meet all the criteria for SSI under income and resources, etc., that they could get a little over $400 a month on SSI as well, as long as between both the benefit on the parent's record and the SSI disability doesn't go over the SSI benefit amount. So these are entitlements that we at Social Security look for the individual. Whenever an individual comes in and files for Social Security, whether it's for SSI or SSDI, whether a person is filing for retirement, we will ask, do you have any minor children? If they do, then we look into these types of entitlements for the individual. So keep that in mind, that we're always looking for entitlements for our recipients, and we pay them the higher of those. So I was mentioning the SSI benefit rate this year, and it happens to be $914 a month. For a couple, that benefit amount is $1,371 a month. So I know you're probably thinking, okay, so why is a couple rate not twice the SSI individual rate, meaning not $914 times 2 for each of the members of the couple? Well, it's simply the way Social Security was legislated. It's a base needs program. So I guess the assumption is that if a couple is sharing expenses of food and shelter, etc., It's a lot easier to get those expenses paid for when you're sharing the expense. But that is the couple rate. These rates go up slightly every year. There is a cost of living increase every year for those. The resource limit I mentioned earlier, $2,000 for an individual, and then for the couple rate, once again, it's $3,000 as an eligible couple. Let's talk a little bit about SSI and parental income. So important because, of course, as I mentioned, it is a needs-based program. So we look at the income that the child might have, but also the income of the parent of the disabled child filing for this benefit. We only look at the parental income up until the time the child is 18 years of age. We also only look at it if the child lives with the parent. So if the child lives in someone else's household, we do not count the income of the parents. Some parental income is excluded, and we look at the number of other children that the parents have in the household who do not receive SSI. The more children in that household, the more of the parental income that's excluded, meaning that doesn't count towards the SSI income level. And the reason for that is that Social Security assumes that the more children that are in the household, the more that parental income goes towards the support and maintenance of those other children. Their entire income does not go solely towards the support of that SSI eligible child. So that's why a lot of that parental income is excluded if there are a number of children in the household. I'm going to give you a simple example, because of course you can imagine that there could be thousands of scenarios, whether there's one parent in the household with 5 children or 2 parents in the household with 1 child. The income limit would vary, but as a general example, let's say that there are 2 parents in a household with income from earnings, and there are no other children in the household. It's just the 2 parents with 1 child. Well, reduction of the SSI benefit would begin if their total earnings, gross earnings, is $2,867 a month or more. If the combined income is less than that this year, it does not affect the SSI check of the child at all. Now, if the total parental income, if the gross total is $4,695 or more, then the child is no longer eligible for SSI because they're no longer meeting the income criteria. So a lot of children might have a disability that qualifies under the medical criteria, but if the parental income is higher than the limit, they would not qualify for the SSI. However, at age 18, we no longer count that parental income. So many children, upon reaching age 18, are newly eligible for SSI. We would only look at their own income and resources if there is any. We do a lot of outreach to middle schools and high schools to make them aware of this provision under SSI. A lot of times children with disabilities are transitioning out of school. So we take part in the school transition fairs. We try to make the social workers aware of these provisions so that they can inform the parents that children might be newly eligible based upon the fact that we're no longer counting the parental income. So keep in mind that there's so many different scenarios, as I mentioned. So I'm providing an example there, but certainly if your income is anywhere around these limits, and if you have other children in the household who do not receive SSI, then you are probably eligible to qualify for SSI for the child in your household. So SSI counts both earned and unearned income. So we already talked about wages as being an earned type of income. We also count net earnings from self-employment. That's whether it's an individual filing for SSI or if it's a parent with earnings. Okay, we do count that type of income as earned. An individual filing for SSI, if they get payment for services, if they're working in a sheltered workshop, meaning a highly supervised work environment for people with disabilities, we do have to count those earnings. On the other side, what we consider to be unearned income comes from, for example, if they're also eligible for SSDI. We do have to count that. We have to count any veterans benefits. There's certain types of veterans benefits that we can exclude, but we have to look at the type of veterans, whether it's veterans pension, a veterans compensation could make a difference. We look at unemployment benefits and workman's compensation benefits. We have to look at any interest that the individual might receive, any private pensions, and also any cash assistance from family and friends on a regular basis. If a person, for example, can't cover their living expenses with their $914 of SSI, if they have to get help on a monthly basis and somebody is giving them money, we do have to count that as income, and that would cause that SSI check to be lowered. So keep that in mind as well. We do exclude a lot of income. And when earnings is concerned, this is for the recipient themselves. We count less than half of gross earnings against their SSI check. So I like to give you a real simple example with simple figures. Let's say that somebody is grossing $185 a month. Let's say they work in a sheltered workshop and they don't earn a whole lot of money, but they do work. The recipient grosses $185 a month. SSI gives an $85 a month across the board general exclusion on earnings that the SSI recipient has. So if they're earning $185 gross, as far as we're concerned, they only earned $100 because we exclude the first 85. So once we looking at that $100 a month, we only actually count half of that, meaning $50 against that SSI check. So this year, if someone is working and earning that 185 and they're potentially eligible for up to $914 of SSI, since that's the maximum benefit amount, we would really only reduce the the SSI benefit check by $50. So that is a concept that sometimes is hard to have a recipient realize, because really the only thing they hear is, oh, if I work, my SSI check will be reduced. But what we make sure that they understand is that, yes, your SSI check would be reduced by $50, but keep in mind, you're also going to have your earnings from work. And at the end of the day, I should say at the end of the month, you're going to have more total income than just your SSI check, 9 out of 10 times. Okay. Some other exclusions: the value of food stamps does not count at all. Home energy assistance. Let's say periodically you have to go to your church or to some type of community organization that helps with utilities periodically. If it's on a periodic basis, that doesn't count against your SSI check. We don't count 1/3 of child support received monthly against the child's SSI. So there are some good exclusions under SSI. A lot of times people do not file for the benefit because they're getting certain types of assistance and they think that this may affect them. But we want to make sure that the public is aware that a lot of assistance type help is excluded and will not affect the SSI eligibility or SSI check. Let's talk a little bit about what we count as far as resources and what we don't. Well, we do have to look at the value of any type of assets, bank accounts, certificates of deposits, IRAs, and that counts. The $2,000 resource limit counts. So if those things are above the $2,000 limit, it would disqualify an individual from qualifying based upon the resource criteria. Stocks, bonds, 401ks, anything of that nature. A second car, okay? Life insurance, what we look at is the cash surrender value. If that's over $2,000, it could affect eligibility. And property other than the home where you live. So let's say I live in a home that I own, whether I own it or I'm still paying a mortgage note on it, but I also own a second home. Let's say I own that second home with my brothers and sisters. When our parents died, they left us the home. The home is worth, once again, I'm going to use a simple figure. Let's say the home is worth $20,000. My share of that, because I own it with my brother, my share between the two of us is $10,000. Well, that counts against my resource limit. The home I live in does not count at all. So that's excluded, as you can see there on the right. The home I live in is excluded. Also, one car is excluded no matter the value. That car can be worth over $2,000. It does not matter. If you own a second car, then the value of that car applies towards the $2,000 resource limit. With burial plots, those are excluded with very few exceptions. Usually those are irrevocable, meaning that you can't choose to turn them into, cash them in for money. So those for the most part are excluded, and also some resources set aside for burial. So let me give you an example of that. I can have a separate bank account with $1,500 set aside for burial. That's the amount that's excludable for burial. As long as I don't touch that money, it's considered resources set aside for burial. So I can technically have two bank accounts. One with $1,900, which is perfectly fine. It's not over $2,000. And then I can have another bank account with $1,500 or up to $1,500. And as long as I do not touch or go into that second account and start using that money, it does not count towards my resource limit. The moment I start tapping into that money, it's no longer considered set aside for burial, so it counts towards my resource limit. Okay, but as long as it's not touched, it can be saved as funds set aside for burial. Just a little bit before I go on to living arrangements, with life insurance policies, what we look at is the cash surrender value that applies towards the resource limit. So usually term life insurance policies tend to not have cash surrender value. And unless it's a life insurance policy that an individual, say an older person that's had it for years and years and years, it might not have a remarkable amount of cash surrender value. So those are usually not too much of a problem unless it's an old policy that has gained a lot of cash surrender value. Let's talk a little bit about living arrangements. So with living arrangements, that's something else that can affect the amount of SSI paid. If an adult lives in someone else's household and does not contribute towards their share of the household expenses, SSI looks at it as if they're receiving assistance in kind, meaning that the household is not handing you $100 a month, but if they're allowing you to pay less than your share, you're receiving assistance in kind from the household. And the way that works is if there are 5 people in the household, your share would be 1/5 of the basic food, shelter expenses, meaning rent, utilities, and food, or mortgage note, utilities, and food. We don't count telephone, we don't count cable bill, we don't count those extras. And that's a good thing, because the more we count, the less the individual is able to contribute their share. So we only look to see that the individual is contributing their share of the basic household expenses. If it's a child living in a household other than their parents, we also look to see that there is a contribution out of that child's SSI check towards those household expenses. If it's a child living in the home of the parents, it's assumed that that's happening. So we don't look into that any further. Adults and children who are in any type of institution, meaning a hospital, any type of facility that provides food and shelter. As you can imagine, for example, a hospital, when you are hospitalized, that's your shelter, and your food is included. So usually Medicaid is paying for an SSI recipient's care in a facility such as this. So the maximum payable while they are in that facility for throughout a calendar month, the maximum payable is $30, because food and shelter is already being paid by Medicaid here in Louisiana by the state of Louisiana. Okay. The other good thing is that if the child is an inpatient in a facility or an institution, while they're in the facility, throughout a calendar month, the parental income and resources do not count. So I mentioned the premature babies. We get a lot of applications on premature babies when they're born prematurely. A lot of times they have to spend a number of months in the hospital until they catch up. For those months, if they are approved for SSI, Medicaid pays for their stay in that hospital. So we can pay them the $30 monthly allotment that honestly, it's just for incidentals, for snacks, anything of that nature in the case of an adult. But Medicaid is already paying for their stay in the hospital. But they qualify because we're not counting the parental income. Once the child comes out of the hospital, we do have to start counting the parental income again, which might disqualify them from continuing to be eligible for SSI and for Medicaid for that reason. But certainly while they need that Medicaid the most, while they're in the hospital, the parental income is not counted. So that's another good provision. So I mentioned about children living in someone else's household. So I'm going to talk a little bit about when a child turns age 18 again. I mentioned how we attend transition fairs and so on and so forth to make sure that families and social workers, for example, are aware of these provisions. But I mentioned that at age 18, we no longer count the parental income. But we also have to do a medical reevaluation. And since the child has now become an adult at age 18, we have to apply the adult definition of disability, which, as you might recall, it does incorporate the ability to work. We weren't concerned with the ability to work prior to age 18, but now at age 18, a reevaluation is done to see if that child, now an adult, is able to do any type of work. Let's keep in mind that not all disabilities bar an individual from doing some types of work. Let's take the example of a child who may have been receiving SSI due to some learning challenges. Let's say the child graduated with a certificate instead of with a diploma. So they were receiving SSI for the time period under age 18, but now as an adult, it is likely that we might find that that individual is able to do some types of work in the general economy. Just because there are some learning challenges doesn't mean that they can't perform some type of job duties. They may not be able to continue receiving SSI. But there are many children who, upon the reevaluation, are still found to continue to be disabled, even as adults, and they are therefore found that they cannot do any type of work in the general economy, depending upon the disability that they have. So it could go either way. At age 18, sometimes children become newly eligible because we don't count the parental income. They weren't meeting strictly the income and resource criteria, even though they met the medical criteria. But at age 18, they might be meeting, they might not be meeting the ability to work requirement anymore. Okay, so it could go either way, but those evaluations are routine at age 18. I'm providing here just a kind of a side-by-side comparison of the SSDI and the SSI programs. But it's basically everything that I mentioned up until this point. And you will receive a copy of the presentation so that you can go back and look at that again. But I'd like to talk about the application process at this time. What's needed? Well, of course, the Social Security numbers for the child, for the parents. If it's an adult applying for SSI, if they are married, we're going to need the Social Security number for that spouse. We're going to need W-2 or self-employment tax forms if it's a child living with a parent, or if it's an adult that they themselves are still working. If they're under that SGA limit, they're potentially eligible. So we may need the latest check stub. We may need to confirm the earnings amount of the spouse. If the SSI applicant is married, that's something else we look at. The bank information for direct deposit, we may need to verify how much is in the bank. Information regarding any other income and resources of the child or the parents. And then just as importantly, we're going to need names and addresses of doctors, hospitals, clinics. That's the medical information that Social Security will review to take into consideration when making that medical determination as to whether the individual is meeting the eligibility requirements for the medical aspect of eligibility. You do not have to have the medical records yourself, but if you do have them, we will accept them. We don't require the records because sometimes the institution will charge for those records, and we don't want people to incur that expense. We will pay for them ourselves if need be. But certainly if you have them, we will accept them. We're going to need to know what medications are being taken. We're going to need school evaluations. A lot of times a parent will have that IEP available. We will accept those, but anything you don't have, we can request as far as medical information. The application process is basically the same whether a person files online or if they seek the help of a Social Security representative. The application is reviewed by a representative in the Social Security office, whether you submit the information through our internet or over the phone. The process is the same. So don't let that keep you from filing online. It's a quicker process, actually, if you file online. The information gets into our system and is sent over to the Disability Determination Services that starts to work on the medical criteria within a couple of days. Right now, we are encouraging appointments to file with a representative. Those appointments are generally done by phone these days, but I will warn you that sometimes our appointment calendar is out for a month or two, depending upon the metropolitan area you live in and how busy that office is. You might have a lot of appointments taken up, for the next couple months. So even though you are protected from back through the date that you called and made the appointments, the appointment, should you be approved sometime down the line, you may be eligible for some retroactive benefits. Keep in mind that if you're waiting 2 months to even give us your information, you're 2 months behind in getting that ball rolling for a medical determination. So that's why we encourage filing online. And I just want to reassure you that you're not doing the processing yourself. You don't have to know all these rules and regulations. Someone in the Social Security office is reviewing it and contacts you. If, for example, you list that you do, if it's an individual, for example, an adult filing for SSI, if you indicate that you have worked and paid into Social Security, we're going to go ahead and contact you and say, okay, well, let's go ahead and get you set up for both SSI and Social Security, since you have also worked and paid in. And so we capture all that information according to how you answer the questions online. So just keep that in mind. If you do want to make an appointment, we have our 1-800 number available, and I'm going to give that to you during this presentation in a minute. But let's talk a little about this agency that actually does the medical decision. The person who sits in the Social Security office does not make the medical determination. Actually, the determination is made by a team at our Disability Determination Services. It's a team composed of medical professionals. There might be a psychologist, a psychiatrist involved. If there's a mental impairment involved, there are also lay disability specialists, such as vocational rehabilitation specialists that know what types of work people with certain conditions might be able to do or not do. So those are really the individuals that are qualified to make those determinations. So that's why the medical decision is basically passed on to them to make after we in the Social Security office evaluate the non-medical criteria. And if you appear to meet the non-medical criteria based upon how long you worked and paid in, or do you meet the income and resource criteria for SSI, then it's passed on to these folks at the Disability Determination Services. So they might even need to send you a form to complete if they have additional questions about what you feel you're able to do or not able to do on a daily basis. If they do not have all the medical information they need, they may need to schedule the individual for what's called a consultative examination. This is basically to obtain that piece of medical information that's missing from those medical records. So you may get a request to attend a consultation with a specific doctor. Those doctors don't work for Social Security. They're strictly doctors that make themselves available to provide testing and send us the results. They do not tell us whether they think you're disabled or not. They never know whether you're approved or not. They simply provide that tidbit of information that we might be missing in order to make a determination. So once the DDS does make that determination, the person gets a letter letting them know what the decision is. Are you approved or are you not approved? If you're approved and it's SSI that you're eligible for, we're going to need to do a quick update of income and resources. Keep in mind that the last time we got information may have been a few months ago, because the decision can take 2 to 3 months. So once approved, sometimes it's been a while, things can change. So we want to make sure you're still meeting the non-medical criteria for SSI. If any of the benefit you filed for, whether SSDI or SSI, is not approved, you'll get a letter It will give you appeal rights, and we do encourage that you appeal within 60 days of the date of the decision. And we encourage appeals. A lot of times people get frustrated and they don't file an appeal. And then 2 or 3 months pass, and here you are, still with the disability, probably getting worse. And then you file again. Well, filing again is starting over, as opposed to if you file your appeal, it keeps your case open. If that case is approved somewhere down the line, there's a possibility that you may get back pay back to the first time, back to the period when you actually applied. Okay, so it keeps that information open. So that's why we encourage appeals and not just filing over and over. Okay, and the appeals can be easily done online with a My Social Security account. Let's talk about that. If you're 18 or over, we encourage you to create a My Social Security account on our website. This is an account that you set up for yourself with a username and a password. It's locked down with your username and your password, and whenever you go in to access that account, it's a lot like online banking where you get a code to put in, and someone that does not have your phone will not be able to get into that account because they won't have that code. So it's extra security measures, but it's great to have an account because you can transact just about any business you have with Social Security through that account. You can get a replacement Social Security card. If you're getting benefits, a benefit verification letter can be printed on your home computer. You can change your address, your phone number, start or change direct deposit. So many things can be done via that My Social Security account where you don't have to call or go into an office. So we encourage that. The My Social Security account also gives estimates for people that are not disabled. Just if you're looking to get estimates, should you become disabled or for retirement, you will get those estimates with the My Social Security account. It's basically the online version of the paper statement that we used to send out on a yearly basis. This is the electronic version of that. So a good account to have whether you're receiving benefits or not. And with that, I want to thank you for your patience and in receiving this information from me today. And I am glad to go ahead and answer any questions you might have.
Thank you so much, Ms. Maria. We truly appreciate the wealth of knowledge that you bring to this presentation and the clarity as well. Getting to the questions. Well,
Yes.
and let me first say, you will get resources after this webinar is over. We will provide a thank you for attending email, which will have the evaluation link. And then it will also have resources that Ms. Maria has provided to me for me to provide to you to hopefully answer some questions. The chat went from having 2 responses to having 9. So if I might be reading something I shouldn't be, because Wallace is kind of trying to help get information back to attendees. But the first question I see is, do adults who receive SSI have to report their parents' marital status?
No. If you're an adult, age 18 or over, and getting benefits on the parent's record, no, you don't have to report anything that happens with their marital status.
Great. And I think Wallace has kind of addressed some of the other questions. The next that I see is, do you have people who can assist those with intellectual disabilities in filing the paperwork and other necessary things to get their claims filed?
Absolutely. As I mentioned, if you're not comfortable using our online services, excuse me, you can make an appointment, and a representative will file or help you file by phone, and guide you through the application process, just basically asking questions. And if you have some questions along the way or not sure how to answer a question, you're more than welcome to say, I'm not quite sure, what information you're looking for. I'm not sure what you mean by that. Absolutely. We do that on a daily basis.
There was a question by someone that asked that needed some help filing on the behalf of people with intellectual disabilities. They said the parents were deceased for the individual. So they're definitely going to have somebody help them.
I'm wondering if it's a minor child, of course, we would look to see who the guardian or who has, physical custody. If it's an adult, specifically the online application will ask if you are the person filing or if you are someone helping the individual to file. So you can help them file online. And same thing, if you call and make an appointment, just let them know that the person needs assistance and you are helping them. Now, the person will probably have to be, on speakerphone with you, something of that nature, but absolutely you can assist.
So the next question is, let's see, how soon can you apply online for benefits before your child turns 18?
I would say it's actually, as I'm thinking this through, it's the day the child turns 18. You can file as early as then. You can't file any sooner because, of course, they're not 18 yet. But the day they turn 18, you definitely can file either online or call for an appointment.
Great. So the next question, for SSI, how much child support is excluded when the child turns 18? Is it still 1/3 reduction or more since the child is now an adult?
So I'm wondering, because normally when a child is an adult, child support per se is no longer paid. Now, what we consider child support is either if it's paid like through the state or the courts. If they're an adult, we wouldn't necessarily consider it child support, so the 1/3 would not apply. We would count it probably as a source of income to that adult. So if that parent is still paying, let's say, $200 a month, that would affect that SSI check as $200 a month of income.
Okay. I'm checking to see if I've missed anything. Please feel free to put it back in the chat if I have. I'm trying to filter the resources that we're providing as well as the questions that are coming in. And there are people that you can talk to at SSI. I know we've had this conversation in the past. And if you're not satisfied with the response that you've gotten when you've called in, you can call and speak to someone else. Ms. Maria isn't someone we have direct access to for personal questions, which makes me sad because she does this very, very well, but that's not her role. There are people that do have that role though. And so, call SSI and, try to get your questions answered that way. And they can help you with some of those more personal situations. Those are very difficult to discuss in this kind of format because sometimes the answer is not simple, and sometimes the answer is not what we want it to be too. So, but
You're absolutely right. You're absolutely right.
it's
And
just not easy sometimes.
no, I understand. And if you are ever in a situation where you've tried over and over again and you're not getting, you know, satisfaction, even if you haven't, like, even if it's your first time, and, you know, feel free to ask to speak to a supervisor. You're always welcome to do that. You know, the supervisor might say, no, you know, the representative you spoke to is right, you know, that's how it works. But if it's a matter of you just not being satisfied with that representative and how you're treated or whatever that might be, absolutely ask to speak to a supervisor. I promised to give that 1-800 number and I failed to do so. Let me do that now. Even though it is in the publications that that families making helping families will make available to you that I provided, but it's 1-800-772-1213. Once again, 1-800. Thank you, Dave Lynn, 772-1213. And that customer service number is open 8 a.m. to 7 p.m. And of course, if you call early, right when it opens, or wait till later evening, it's going to be a lot easier to get through. I would probably say later in the evening between 5 and say 6:30, you'd probably get through a lot easier. But definitely, you know, stay in touch with organizations that assist you, like Families Helping Families. And if you come across any real problems with getting anything taken care of in the local offices, you know, they will reach out to me for help as well. But like Dave Lynn said, you know, my capacity is more educational, but I am also very interested in, you know, the service that the public receives. And so we would want to help out with any concerns like that you have.
And that's our role as parents and as caregivers, to be advocates. And so I appreciate that she went as far as saying, you know, ask for a supervisor if there's something that's not working. We do have another question, and I'm hoping you understand some of the terminology here that I might not.
Okay.
We have a question from a parent. When I turn FRA, can my disabled daughter receive SSI or SSDI until she is 18?
Okay, so FRA means full retirement age.
Okay.
So when the person turns full retirement age, here's what might happen. When you take your benefit at full retirement age, we will ask you if you have any minor children or any children who are disabled and have that disability since prior to age 22. They may be able to receive a benefit on your record that's higher than any benefit they're currently receiving. They might be receiving SSI, $914 this year, but the benefit amount, if you've worked and paid in for a long time at a high level salary, they might be eligible for $2,000 a month on your record. So absolutely, we would pay them the higher of the benefits due.
Great.
I hope that
Great.
answers your question.
I think so. And I'll check to make sure. Another, if I'm working with a disability and my ability to continue working is getting worse, when can I apply?
I would say apply right away at the point at which you're noticing that your condition is getting worse and you're becoming less able to work. You're having to slow down your work activity. Now, keep that $1,400 or so a month substantial gainful activity level in mind, though. I would say at the point at which you it's $1,470 a month. If you get to a point where you've had to curtail your work activity to under that amount, that's when you apply. But if you're not even at that amount, file right away if you feel like you're losing your capacity to do substantial work.
I always learn so much and so appreciate the time that you've given to us. We are over, and for that I apologize, but you don't really get this information very easily just searching the web, to be honest. We do have another question. How do I find the income cutoff for a child living with parents and other siblings?
What I recommend you do is contact the 1-800 number. They are able to answer any question that you feel like you would have to ask the local office. They are representatives as well. They're just on the phone. They will be able to ask you a few other questions and give you a better answer to that than I am able to give you right now without asking some personal questions that we don't, want to do that in a public forum. But definitely call the 1-800 number and they'll be able to answer that question.
Thank you so much, Miss Maria. I want to thank everybody for attending. Thank you for your wonderful questions. I think probably a lot of times there are questions that we don't think of, and so when everybody puts in, it's just better information for the rest of us. I want to remind you, please, to complete our post-event survey that's useful to us. If Miss Maria has done another presentation for us before, any feedback you can give us about stuff that she could present on or other people could present on, we'd love to have, so that we can get you the information that you need. There are free opportunities. These webinars are free opportunities to gain knowledge and learn about new resources, learn about people like Miss Maria, who brings this information to the masses, and then learn about our community. So on behalf of Families Helping Families of Southwest Louisiana and Miss Maria with the Social Security Administration, we want to thank you again for joining us and have a good afternoon. Thank you so much.